My name is Dr. Alyx Porter, and I'm a neuro-oncologist at Mayo Clinic in Arizona. A neuro-oncologist is a neurologist who takes care of patients with brain cancer. Along with my colleague, Dr. Lynn Taylor at Tufts University Medical Center, we've written a book for patients with brain tumor diagnosis as well as their caregivers. Some of the feedback that Dr. Taylor and I have been given is that when patients are faced with a new diagnosis of a brain tumor, there's lots of information that's thrown at them all at once. The reason we've written this book is to help provide as a resource for patients to go back to long after their appointments are over, and even maybe in preparation for some of those visits, to have some reference materials to look at. We didn't anticipate that this book would be one that you read from cover to cover, but we hope that patients and their caregivers would look through the table of contents and find those sections that are most pertinent for them. For many patients, the first step is assembling their treatment team. Some patients start with a neurosurgeon who performs the initial biopsy or resection of their tumor. Some patients start with a neurologist who may have oncologic training, like myself. In any case, the team is often made up of a neuro-oncologist, a neurosurgeon, as well as a radiation oncologist. From that step, our book really works to help you understand not only what sorts of procedures you might encounter as part of receiving your diagnosis, but also helping you understand what is radiation, what is chemotherapy, what are some of the terms that might be thrown at me that I need to understand. Once you've gotten through the initial treatment and have an understanding of what your tumor is, this book can also be helpful to try to understand what sorts of things can I do to help enhance either the treatments that I'm receiving or just help my quality of life be as good as it can be. So we focus in on talking about alternative management, some different supplements that can be taken. We talk about exercise and things like art and physical therapy, really to help make sure that you're living a well-rounded life in spite of all of the things that you have to go through in terms of the treatment itself. And then lastly, the book is broken down by specific tumor type so that you can be most informed for your particular tumor. Our goal was to make this a comprehensive resource to cover not only all of the medical things that a patient and their loved ones will go through, but also handling things like personal affairs and helping to impact quality of life. We really did want this to be a resource to help work along with your doctors at home so that you can feel empowered. We understand that this is a diagnosis that really takes you out of yourself and out of your life and really is scary. And so what we hope to do is to provide some comfort and some reassurance through education and hope that it can be a resource that you can turn back to as time goes on.